Everybody's staying safe. I have some, I'd like to start off with the approval of September's meetings. We haven't met since September. So if, has anyone read over the minutes? Can I get an approval and a second?
Aye.
I'm sorry, who was that? Diana, we have to unmute.
I think it was Carolina.
I am.
Okay.
You call? Bye.
All right. Carolina, did you approve the minutes?
Yes.
Thank you. Can I have a second? Can I have a second, please?
I think you can second it, Oscar, but
I'll second it. Minutes have been approved and passed. I also would like to introduce our commissioners that have joined us in this meeting today. Kristen Rosen Gonzalez, which I know very well. Welcome. And Alex Fernandez, that I hope to get to know.
Thank you.
And you're very welcome. Would you like to say a little bit about what you guys do and anything you'd like to say before we begin?
Sure. First and foremost, I'd like to thank Diana for inviting Alex and myself to this meeting. This is my first ever Senior Affairs Committee because this is a new committee that was established, I think, a couple of years ago. So it's very exciting. And I was looking at your agenda today, and I'm so happy that you're addressing critical needs like bus routes that are being, hold on one second. Like bus routes that are being that we're losing, that we're replacing with stuff. So I know that these are really important issues for the senior community. I just want to thank Diana, and I'm really excited to be here and listen. I know that the commission is also getting an appointee, I believe, on this Senior Affairs Committee. Is that true or not, Diana?
It is true.
It is?
it's
So I'm not sure exactly who the commissioner will be, but I hope that it will be me because I do love to get involved with the senior events, and I'm looking forward to listening to what you guys have to say today. So thank you so much. Thank you for your wonderful introduction, Oscar, and happy holidays to everyone. Merry Christmas. I hope you guys have a wonderful New Year. Feliz Año Nuevo, prosperidad, felicidad, salud, todo. Okay, thank you.
Thank you. And Commissioner Fernandez.
Thank you. Good morning. Hope everyone has had a safe holiday, and it's a pleasure to be here with you. Actually, it's a very special committee for me because I remember when the idea of it was being discussed. I was the chairman at the time of the Hispanic Affairs Committee, and advocated strongly when this was being proposed because undoubtedly our senior community is such an important and vibrant part of Miami Beach, and we want to make sure that there are the right services available for them, the right assistance, and anything that we can do to improve the quality of life for our residents. And so to the extent that I can be an instrument for this committee, it'd be my pleasure to work alongside all of you. I am at City Hall almost every day. This is my full-time commitment. Unfortunately, right now I'm in quarantine because I did have a positive exposure before the holidays. But I look forward to working with all of you and being an instrument. The doors to my office are always open. You can call me on my cell phone, 786-999-5662, and I'll always be there to assist all of you. Thank you. Stay safe and happy holidays.
Great. Thank you, Commissioner Fernandez. Thank you very much. And I hope you get out of quarantine very soon. And also, can you just put your cell phone number in the chat so that all of us can have it?
Sure. Okay. Absolutely.
So,
it'd be my pleasure.
Following the agenda, I'd like to introduce to you, we have a COVID update with one of Mount Sinai's internal medicine physicians, Dr. Crystal Rago, and I was asked by the committee to see if to get one of our physicians to give us a little bit of the what's happening now with Omicron and anything that we need to get updated. So, Dr. Rago.
Sure. Yes. Hi, everyone. It's a pleasure to be here. Good morning and happy holidays, Merry Christmas, Happy New Year coming up. And I hope all of you are well. And yeah, I mean, will basically kind of go through just generally what's going on right now, and then I'd be happy to answer any questions that anybody has or anything specific. But in general, as I'm sure all of you are aware, there's been unfortunately another spike, and now we're seeing another variant, and Omicron is with us and now in the community and been identified now in the US here. So we're all taking measures and precautions, and what we've been doing has been working, at least in the clinics and the communities, which has been wearing your mask and being vaccinated has been the biggest message that we're all as healthcare providers trying to continue to emphasize and continue to stress the importance of, because it's been the one thing that we've definitely been able to help prevent severe illness, prevent severe transmission and continued transmission. So we continue to emphasize that, because that is one thing that we have in our power to help prevent severe illness. And that's the goal of COVID at the end of the day. We're still going to see vaccinated patients get infected, but the goal is to not have people in the hospital be on ventilators and die from this. And that's our goal, and the main emphasis to be on that. And prevention is still the key. Preventing the spread is still, as much as we can, is the best thing that we can do, because we, as much as we can, even if you're vaccinated, wearing a mask when you're indoors, and especially in areas of high transmission, is still recommended, and continue to wash your hands, social distancing as much as possible, and just avoiding large gatherings and large events that could potentially be risks of spreading, especially if you're not sure where another person has been or traveled to, or their risk and their vaccine status as well. So with that being said, we are seeing a lot of, still vaccinated patients getting infected, but thankfully in my clinic, and I know in a lot of my other colleagues' clinics, the infections of the vaccinated have been thankfully very mild and short-lived, and people have been in quarantine and they get out after 10 days, 7 to 10 days, and go on to live normal, regular lives. So that's a big change from where we were last year, which is really nice. When we saw COVID patients who were infected, we were all very nervous and didn't know where the outcome would be. But now we're seeing milder illnesses, which is always good. That's not everyone, of course, but that is definitely what we're seeing more of now. So yeah, if anybody has any questions, I'd be happy to address anything.
Any questions, anyone? Go ahead, Diana.
I have 2 questions. When you mentioned the 7 to 10 day quarantine, I've heard various things about that.
Yeah.
Go into that in more detail.
Definitely. So the right now the guidelines, especially on the CDC, are that if you are infected and that you have symptoms and that you're sick, you be in quarantine for 10 days. And then once your quarantine has been ended, you can leave after 10 days. If you wanted to shorten the quarantine, you can get tested at day 7. And if you're negative, then you can end your quarantine early. So that's kind of where that gray zone is the 7 to 10. I tend to be a little bit more on the conservative side, where I tend to tell people, look, as long as you're asymptomatic, we can start the 7 days, but most people feel more comfortable with 10. So usually we use 10, and I like to just err on the side of caution, especially given the spread of everything. So 7, if the CDC has recommended that if you are negative at day 7, you can end in order to end the quarantine early. And again, without symptoms. So if you are having symptoms, or if you had severe illness, so another caveat to that is if you have severe illness, they're recommending the quarantine be actually up to 20 days. So, it's going between, and a lot of this is to be discussed once you speak to your healthcare provider, just based on symptoms. I always use symptoms as the biggest gauge. If someone is still coughing and they're still having fevers, they can't end quarantine. You have to be at least 24 to 48 hours without a fever to end quarantine. And just to make a distinction between quarantine and isolation, if you are living in a household with other people, so if the instance is, for instance, let's say a spouse and, one is positive, one is negative. If that's the case, isolation is where that one person who's positive goes into their bedroom or one room in the house that's completely theirs. They use their own toilet, they use their own utensils, they use their own, equipment basically for that 10-day period. And that's isolation. Quarantine, of course, is, just being in a place outside of the general public. And so if everybody in the household has been tested, and, we're seeing that a lot where the household is just everybody's positive. And so that household is in quarantine, and they're in quarantine where they're not going to grocery stores, they're not going to restaurants, obviously. They're minimizing their contact as much as humanly possible. So that's kind of the distinction between isolation and quarantine. And then the 7 to 10.
Thank you. You answered my second question.
Perfect.
Okay, Commissioner Fernandez?
Yeah, I have a question about the 7-day testing, and that would be a PCR test in that more conservative approach that you're looking at, correct?
Yes. And I know it's been a challenge getting tested for sure, because of the volume of people and the volume of, but yes, PCR is preferable because of the accuracy and yeah.
And is it a repetitive PCR? In other words, you can't just test positive once, you should test positive twice, or what's the recommendation regarding that?
Sorry, could you say that question again? It cut off a little bit.
Is the negative PCR testing, is that one test, or is that a repetitive negative PCR test?
No, it's one. It's one.
Oh, really?
Yeah, it's one. And the gauge of that is purely based on the fact that if you are negative on PCR, it's a good test where we can, reassure that, okay, this is, fine, and also without symptoms. So if you're still testing and you're symptomatic and you have a negative test, my suggestion always to patients is you're just going to wait till the 10 days, because it's just not worth it to go out even with, because nothing is perfect, with these testings. And so, and especially given the sample, as long as the sample is a good sample, adequate sample, we can hopefully rest assured that it's a good sample size and a good test. But, there's so many variables with these things. So my gauge is at 7 days, if you are completely symptom free and you get a negative test, the CDC has recommended that you can end your quarantine earlier than the 10 days.
Wonderful. Thank you for the information.
Yes.
Anyone else have any questions? Because I do have one question, and
Sure.
This is regarding regional infusions. When is it that you're supposed to take it? When is it you're supposed to go into the emergency room and see the physician or ask or make an appointment for the infusion?
So the monoclonal infusions are basically offered now in a certain criteria of people. It's a little bit wider than it was last year, but the conditions are for the monoclonal is that you are not sick enough to be admitted to the hospital, that you are having symptoms, and the risk of progressing to severe symptoms is what the reason is for monoclonal. So we have a handful of patients who will get a little stuffy nose, feel a little bit congestion, and they're fine, and they're young, and they're not overweight, and there's very minimal risk factors for them. Those patients, for instance, don't need monoclonal. The monoclonal are infusions for patients who have a body mass index of greater than 25, so they're technically considered overweight, and who have other comorbid conditions, diabetes, pregnancy, immunocompromised, hypertension, lung issues, organ transplants, things like that. People who are at higher risk of the disease progressing from mild to severe or moderate to severe. And the criteria is such because at the end of the day, even though it's a synthetic monoclonal infusion, there's always risks, and with everything, there's always a risk of any infusion having an allergy or having even volume that's too much for a patient. So we use that criteria very, very specifically. And Mount Sinai is doing the infusions, and what I've done is every patient who's been positive has contacted me. We set up a telehealth, and we talk about what their symptoms are and where their risks are, where their numbers are. Do they meet criteria for monoclonal? And if they do, then we call the main hospital. We have to set up an appointment and get them an actual time slot where they can go and get the infusion, and that's how we proceed. So it's the criteria, and then the risk of progression to severe illness. And when you are there, when you do go there to get monoclonal, so let's say, Oscar, let's say you and I have a discussion and the decision is to get monoclonal, you would go there and the ER would also recheck your vital signs. And they will make sure your oxygenation is okay. They will make sure your blood pressure is okay. They will do a triage of you to make sure that you are not sick enough to then need to go into the ER and actually be admitted. So there's another check there as well.
Great. Thank you so much for saying that. Go ahead, Diana.
Yeah.
Sorry, another question. Just trying to absorb everything. So
Sure.
I had a friend that tested positive with the home kit, negative with rapid, and then positive for PCR. What are your thoughts on the home kits? Is there a particular brand? What do you recommend for the seniors?
Yeah, it's a challenge. One, availability is a big thing right now. So if you go and try to get a home test, even getting a home test is difficult, like to purchase them. There is, the thing is, a lot of things with COVID is that there's not a standardized kit. There's not a standardized test that we can do. There's all these different companies that have produced these tests and they're now available on the market. So there's not a lot of standardization. So that's obviously comes with problems because and that's the same thing with the monoclonal antibody testing and all of these things. There's not a standardized test. So we can't really recommend one over the other because we just don't have that data. The home test kits are kind of like one of those things where it's like, listen, if you're symptomatic and you test and you have enough virus in your nose and enough virus to get positive, then the likelihood of you being positive is quite high. Right? Now, is that to say that the home tests are be all end all? No, I think that's great that the person who you mentioned went and got a PCR because at the end of the day, that's the one confirmatory test that we have. And it's also not going to, be as subject to a home person doing it. Someone is actually going to be doing the PCR too. Do you know what I mean? Like it's less subject to error. But I do think that it's one of those tests, to kind of answer your question, it's a test to do as a preliminary. It's not to do as your only test. If you get exposed, and so you have a contact that you get exposed to, and you're feeling fine, and you have no symptoms, and you're vaccinated, but you want to go and do something, and you just want to be sure of yourself of what's going on, you could do a home test, and then that would be one way where you don't need to go and get PCR tested, because if you feel well, and you're just going to want to just test before going to going to see grandparents or someone elderly who you're not sure. I think it's a good initial test. I think the test always kind of goes out the doors. Once you're symptomatic, you need to know. So relying on a negative test, on a home test if you're symptomatic, I don't think is enough. I think you should still go get PCR tested.
Great.
Thank you.
Thank you. Yeah. So anyone else before Dr. Rego has to go back to her clinic? Lewis.
All right. Good morning. Yeah, I'm unmuted. Just in terms of hospitalization numbers, deaths, I don't know if you have that, Dr. Rego, or maybe Oscar has that. How does that look like for Mount Sinai right now? Or maybe the county? I don't know if you have that data.
Oh, I actually don't have that specific data. I actually only do outpatient medicine, but I don't know if Oscar has those numbers, and I don't want to give any false or inaccurate information. But from my clinic's perspective, what I'm seeing a lot of are milder cases, thankfully, in the vaccinated. My unvaccinated patients, unfortunately, are struggling, and they're struggling for longer. So that is one thing that we're also seeing as well. In the vaccinated, we're seeing milder cases, but I'm not sure if Oscar has that data, that number.
So I do receive that data regularly. Unfortunately, I don't have it with me today because I am in California on a holiday vacation with my family. So, Lewis, I can send that over to you and Diana, and then you can forward it on to everyone. I will tell you, the hospital, we're doing very well. Although we do see a high risk of infection, the hospitalization is down, like Dr. Rego has said. So I do get a lot of people from the community asking me when they should go and get the infusion. There's a lot of question about that, so I was glad that Dr. Rego was able to emphasize, the protocol for going to get an infusion. So it's not to show up at the hospital or to go out and spend 7 hours at Tropical Park, which I know all of our colleagues in other hospitals in the area, they're being inundated with all people, because once they tested and they had the vaccine, it comes of a little bit of a panic, so they rush to the hospital. And we don't want people to do that. We want what Dr. Rego had said, and if you can reinforce that to the seniors out in the community, I know Louis, Carolina, Cindy, you guys are, right at where you're the boots on the ground with the seniors. So please let them know that. And of course, you guys all have my cell phone number, so you can call me. Like I said, I'm even here in California, I'm still working, so no worries. Just give us a call. We're here for you.
Thank you, Oscar.
Any other questions? We'll go ahead and proceed with our agenda. Let's see. Okay, so thank you, Dr. Rego.
Oh, you're welcome. You're welcome. It was a pleasure. And everybody be safe and Happy New Year.
Great, thank you. So we'll proceed with the agenda, and we have discussions of each senior center. And we'd like to start with, do we have a representative from Council Towers? South or north? Natasha, you're on mute.
You need to unmute.
Natasha, yes.
Hello.
Yes.
Good morning.
Hi. Good morning.
Hi. Good morning from Council Tower South. I wish you a Happy New Year and many blessings. Everything is good. You're welcome. Everything is good and safe. Many residents are with the family for the holidays. The building is on the construction and renovation. Everything is going well. Thank you so much.
Thank you, Natasha. And Four Freedoms.
Sorry, question for Natasha. What happened with the balconies there in Council Tower South? Are they still closed?
The balcony is closed for protection.
Okay. Just wanting to make Louis and the commissioners aware. I'm sure y'all are familiar with this issue, right, Louis? Okay. So they'll be on that in January.
Thank you.
Okay. And Four Freedoms? No one? Federation? Rebecca Towers? Stella Maris? Unidad? All right, Blackstone.
Sorry, before we go, Maggie's raising her hand, so she.
I can't.
I know, sorry.
Go ahead, Maggie.
For Federation. Maddie,
I apologize.
Maggie, unmute. Maggie, you need to unmute. Can you hear? All right, I guess we'll go back to her. Let's go ahead.
I got it.
Okay.
Oh, you got it? Okay. Go ahead.
Okay. Okay. First of all, everybody, happy holidays, Merry Christmas, Happy New Year, 2022. Our building are still under construction and remodelation, and we have some cases of COVID over here, and are going to be very good treatment, and the office is taking care of that, closing the office only by appointment, asking for everybody to wear masks and protect ourselves and, still having the social distances. So I hope that the next year our construction finish and we can enjoy this beautiful building as much as we can. Okay, that's it. No more problems.
Great. Thank you so much, Maggie.
Okay,
Thank you.
you're welcome.
So is that it for the community centers and the senior centers?
No, Maria Marrero.
Maria?
Yeah, for Blackstone.
Blackstone.
Hi, Maria.
Hi. Hi. The building is doing good. They're doing construction and renovation. The senior, I see that they're wearing their mask and they're keeping safe. We have some COVID cases, but they're not it's not the elderly. It's more the younger crowd. As you know, we had a shooting last week. After that, it has. I think they're evicting the people. They're trying to evict the people from that apartment. It's only one apartment that it's really bad. Hopefully they'll be able to evict them. As of yet, I think they're still there. The people who rent it. Other than that, everything is is doing better. I see the building much cleaner. The maintenance is. They're doing their job.
Good. Well, I'm glad everybody was safe. Thank you, Maria.
Yeah, everybody was safe. Thank you.
Okay, great. All right, so to move on, any questions about this? All right. Now I'd like to introduce, I guess, our new staff liaison. This is a gentleman that I've had the pleasure of working with most of last year. He's great at coordination. He's very personable. He has a great attitude until you give him a bullhorn, but I hope that somebody took that away from him. Louis, would you like to introduce yourself, please?
Yes, absolutely. And the bullhorn is actually dead. I think it malfunctioned, so you're safe from that. And again, it's Luis Callejas with Commissioner David Richardson's office. I've been with the commissioner now, I think, 5 years, when he was this former state representative for Miami Beach. And he launched a campaign for Congress. It was unsuccessful, so we took 7 months off, more or less. And then he invited me back to help him out when he ran for city council, city commission in, I think it was June of 2019. And so we got elected in November of 2019, and he's been a commissioner for now 2 years. So we're halfway through our term. And so, yeah, I've been with him, gotten to know the community pretty well. Like Oscar said, we did a lot of work during the pandemic. During March of 2020, we got really busy to make sure that nobody in Miami Beach went hungry. And I think we accomplished that mission. And we still continue to do those efforts at a scaled back level, but we're trying to make sure that our seniors are still well taken care of. And that's who we largely see now at the food distributions, is our senior community. And so I'm excited about this position. I want to thank Diana for showing me the ropes and showing me how it's done and setting a great example. And I look forward to working with whoever is appointed. I think the mayor's going to be making decisions, or the commission's going to be making decisions as to who will be on committees, hopefully sometime in early January, if not on the commission meeting January 20th. So we're excited to take this on, and hopefully I get to meet everybody in the committee. And that's what I will try to do, try to meet individually with everybody before we have our meeting in late January, I think it is. So again, Luis Callejas, excited to bring what I've learned over the few years to the table.
Great, thank you, Louis. And you certainly do have big heels to fit into in Diana as well. She has done a fantastic job, and I know on behalf of Debbie and everyone else on this committee, we want to thank you. You've kept us all in line. You've kept us all informed, and again, just a world of thank you from the bottom of our hearts. Any other questions? Diana, do you want to say something?
Sure. No, I just want to thank each and every one of you. It's been a pleasure working on this committee. As you know, seniors are super, super dear to my heart and Commissioner Gongora's, and so it really was a pleasure. I didn't see it as extra work. I really, really, truly enjoyed working with each of the senior centers and each of the representatives and trying to accomplish the mission of the Senior Affairs Committee. So I know that Louis is going to do an amazing job and keep the committee going strong. And so, yeah, thank you again. And thank you for the beautiful flower arrangement. It made my day yesterday. So thank you, committee members, and Debbie and Oscar and everybody. I love you all.
Thank you. Thank you. So with that, any new business? Anybody have anything to say? This is, like I said, our final meeting.
Yes.
Carolina.
Yes, we have this January 6th, we have a festival with the Commissioner David Richardson. So maybe Luis, you send the flyer, or maybe I send for the seniors, or I don't know, the seniors affairs. I send the flyer. Yes.
Yeah. So if I could speak on that, Oscar.
Yes.
The chair. So Commissioner Richardson is planning and I don't want to sort of take over here, but since Carolina did bring it up, Commissioner Richardson is planning a Three Kings extravaganza, we're calling it. We're going to have vallenato music. Melina is going to be our headliner. And so January 6th from 1 to 5 p.m. in Collins Park is what we're aiming to do the event. And so hopefully everybody can come out and wear masks, socially distance, and try to be as safe as possible. But hopefully we can celebrate the closure, if you will, because for the Hispanic community, that's sort of like the end of of our holidays, basically, with the Epiphany. So everybody's welcome. It's going to be great. I think we're going to have food, music, and we are planning to do a pop-up vaccine site as well. So seniors can get vaccinated, or anybody else from the public can get vaccinated on that day as well. So everything's being planned, and hopefully we have a great event this January 6th. And
Great.
we can certainly get the flyer around through the chair.
Perfect. Thank you so much. Yes, please send it to us so that we can disseminate it out in the community. Okay.
Cindy has her hand up.
Cindy.
Hi, good morning. Just wanted to thank again Diana for all her hard work and that she's done for everyone and all the seniors. I know that they love her very much, and also congratulate Louis. He's going to be a great addition, and he'll have some pretty big shoes to fill, like Oscar had said. Just wanted to see also, Oscar, if we can follow up in the new year on, we were able to tackle half of the issues with the buses. I'd like to continue on. I'm continuing on that with transportation, because Larissa's not on the call today from Unidad, but I've had several conversations with her. And I know Diana is also aware, and I'm sure Louis is that a lot of the seniors that get their daily lunch at Unidad, they take the 115. And the 115 is being eliminated by Higgins. I've had several conversations with Louis. David has done quite a bit of outreach for us to try to help. So I'm hoping we can continue that conversation to come up with a reasonable alternative, because that's their only way to get their one meal a day sometimes. So I'm really concerned about that. I know we were able to tackle half of the battle, but that's also their way to get to Mount Sinai. To see doctor's appointments. So it is used more than they're saying. And I found out from speaking even to Alex, Commissioner Fernandez, that, people in his area, because he's mid-beach, do utilize the 115. So just want to make sure that stays on the radar. Thank you so much.
Thank you, Cindy. So I did see Louis writing down some notes, so I'm pretty sure he's already put that on his agenda. All right. Anything else for new business or any comments before closing?
So the next meeting, if y'all continue to meet on the last Monday of the month, would be set for January 31st. It's up to you guys if y'all want to continue that, and Louis will go ahead and get that on your calendar.
Okay.
If that's the day y'all want to stick to.
All right. Anything else? Well, board, friends, colleagues, thank you so much. Really appreciate all your time, all the effort that you guys put into making this committee work for the seniors of Miami Beach. And we look forward to the new year, a new, better, brighter, less COVID year. And again, thank you so much. And we'll see you on the 31st.
Bye, everyone.
Bye.